IoT systems in healthcare improve existing technology and the practice of medicine in general. They extend the reach of experts both within and outside of a facility. Through broad data collecting from big sets of real-world situations, they improve both the accuracy and the amount of medical data. They also improve the precision of medical care delivery by integrating the healthcare system more thoroughly. First use healthcare applications of IoT is in research. Much of today's medical research is based on resources that lack important real-world data. For medical evaluation, it uses controlled surroundings, volunteers, and essentially leftovers. Through real-time field data, analysis, and testing, the Internet of Things provides access to a multitude of useful information. Through interconnected instruments capable of conducting feasible research, IoT can give relevant data superior to normal analytics. It also incorporates into actual practice to provide additional critical information. This benefits healthcare by supplying more reliable and practical data as well as better leads, resulting in improved solutions and the uncovering of previously unknown issues. Researchers can also prevent dangers by acquiring data without using contrived scenarios or human testing. Next is devices. Current devices are fast advancing in terms of precision, power, and availability. Nevertheless, they still fall short of an IoT system that successfully integrates the correct system. The Internet of Things, IoT, unlocks the potential of existing technology and leads to the development of new and improved medical device solutions. By building a logical system rather than a collection of tools, the Internet of Things bridges the gap between equipment and the way we offer healthcare. It then reveals patterns and missing parts in healthcare, such as clear defects or obvious fixes. Any computer can be used as a supporting machine for the ClearProbe portable connected ultrasound instrument. All imaging records are sent to the master system via the device. Third one is care. Perhaps the most significant benefit of the Internet of Things in healthcare is that it allows healthcare practitioners to better apply their skills and knowledge to solve problems. They have access to significantly superior data and equipment, giving them a window into blind areas and allowing them to take more rapid and precise measures. The disconnects in present systems and faulty data no longer constrain their decision-making. IoT also benefits their professional development because they are able to put their skills to use instead of wasting time on administrative or manual activities. Because technology provides a better viewpoint, their organizational decisions improve as well. Fourth one is medical information distribution. One of the most difficult aspects of medical care is providing patients with correct and up-to-date information. Given the difficulty of following instructions, healthcare likewise issues with direction. IoT devices improve not only facilities and professional practice, but also people's health in their daily life. In comparison to previous solutions, IoT devices provide direct, 24/7 access to the patient in a less intrusive manner. They bring healthcare out of hospitals and into people's homes, offices, and social settings. They enable patients to take charge of their own health and allow clinicians to give better, more detailed treatment. As a result, there are fewer miscommunication-related incidents, higher patient satisfaction, and better preventative care. Final one is emergency care. IoT provides for more robust emergency support services, which are often limited in resources and disconnected from the base facility, thanks to advanced automation and analytics. It allows for a more thorough analysis of a situation from a distance. It also allows more providers to see the patient before they arrive. IoT provides important information to providers, allowing them to administer necessary care as soon as they arrive. IT also improves the degree of care provided to a patient by emergency personnel. As a result, the related losses are reduced, and emergency healthcare is improved.